Hello, everyone. I wanted to go over this recently published paper in JAMA, which was published in October 21, 2022. Now, this is information that probably is no longer interesting to people because most people are basically kind of over COVID in that most of us have either been vaccinated or had COVID or both. And the level of concern for COVID is fairly low now in the population, and most of the non-pharmacologic measures have been lifted, and people are just kind of living without much consideration of COVID now, which I think is fine for the most part. And there was all this controversy about the role of ivermectin early on in the treatment. And I had a video a little while ago about the Activ-6 study, which was looking at uh, several cheap medications that are available out in the community for the early treatment of COVID. And one of the treatments that they were so there were three treatments they were looking into: fluticasone, otherwise known as Flonase, fluvoxamine, which is a antidepressant drug, and then ivermectin. Um, and previously, I published a video about the Together trial. The Together trial looked at fluvoxamine, ivermectin, hydroxychloroquine, and metformin. They found that metformin was not helpful, hydroxychloroquine was not helpful, and ivermectin was not helpful, while fluvoxamine was helpful in their trial. Now, a lot of people um, were saying that this was not a good trial because ivermectin was given fairly late after 1 week of initiation of symptoms. And just because of the way that the trials have to be run, you have to have symptoms, then you have to get tested, then you have to enroll after your testing. By the time all that is done, it's very hard to initiate treatment sooner than that. The Activ-6 study tried to do that faster by setting up a phone line and mailing the drugs to people so that they don't have to get enrolled in person, and so shorten the enrollment time. So they were able to get more than half of their enrollees started on the intervention within 6 days, so much less than a week before from the time that symptoms started, so earlier treatment. So they used 400 micrograms per kilogram. That is the dosage that's recommended by this FLCCC group. This is their eye care early COVID treatment. They want you to treat with 0.4 milligrams per kilogram to 0.6 milligrams per kilogram. 0.4 milligrams is 400 micrograms per kilogram. So it's the same dosage. They did it for 3 days. They enrolled uh, almost 2,000 people, and what they looked at was time to recovery, which they defined as 3 consecutive days without symptoms, and to see if ivermectin changed how quickly people recovered from it. And so what they found out that the hazard ratio for improvement was 1. That means that 1 means that there was absolutely no difference. 1.07 means that ivermectin actually was slightly worse than placebo. So the median time to recovery was was slightly better. So the median time to recovery was 12 days in the ivermectin group and 13 days in the placebo group. So the placebo group took 1 more day to get better, but that was not statistically significant. The p-value was 0.91, so essentially the same. So they're saying that this difference of 12 days and 13 days is inconsequential. Could have gone the other way. There were 10 hospitalizations or deaths in the ivermectin group and 9 deaths or hospitalizations in the placebo group. So this also was not statistically significant. Um, there was 1 more death or hospitalization in the ivermectin group than in the placebo group, but it's not statistically significant. It didn't really make a difference. So their conclusion was that ivermectin was not helpful in decreasing hospitalization or death or shortening a time to recovery. This agrees with the findings of the Together trial, which are the only two large randomized placebo-controlled studies on ivermectin. So, I mean, this doesn't really matter anymore because I don't think anyone's really taking ivermectin for this. COVID is not that scary for most people at this point, and we have pretty decent drugs for it. Fluvoxamine is definitely a superior drug than ivermectin. Fluvoxamine is also relatively safe and also relatively cheap. Um, the Activ-6 trial found that fluticasone does not work, ivermectin does not work. Their initial trial, fluvoxamine, showed it didn't work for them, but trying a higher dose at this point and reopening their study and continue their study on fluvoxamine. So in this study, the effect of fluvoxamine is still the jury's out on that. The Together trial used 100 milligrams twice a day of fluvoxamine, and it was superior to placebo in their study. Anyways, I don't know how interesting this is anymore. It kind of goes to show you that to get really good scientific data on these things, it just takes a long time. I mean, we've been dealing with COVID for 2 years now, and now we're starting to get the definitive information, which is kind of in many ways too late. Um, and so when you are dealing with these things initially, we are flying a little blind. We don't know. But at this point, I think it is fairly clear that ivermectin is not helpful for COVID. Um, and so I don't know the utility of studying this kind of stuff further. Right at this point, if anyone wanted to do early intervention with some available, relatively cheap, relatively safe medication, fluvoxamine is probably the go-to drug for that. And then if you look at this eye care drug, they recommend zinc, which I think that's fine. It probably won't hurt you. Spraying your nose with betadine, it probably won't hurt you. That's probably fine. Melatonin, why not? Curcumin, sure. Turmeric, it's not. That's also not going to hurt you. Most of these things are just like very low. There's very low risk to them. Vitamin C, sure, why not? Quercetin, we talked about that. Sure, why not? Um, and then N-acetylcysteine, those kinds of things. I mean, I don't see anything really wrong with that. I mean, I wouldn't be taking ivermectin or hydroxychloroquine. Those have been proven to not be helpful. If I were going to do anything, if I wanted to do a kind of an early treatment for it, yeah, I'd do the zinc, vitamin C, melatonin, curcumin, N-acetylcysteine, sure, do all that. Vitamin D. Um, the best thing, like I talked about in these things, is to not need any of these supplements. We should be getting plenty of vitamin D. We just don't spend enough time outside in the sun to get the amount of vitamin D that we need. People should be spending, probably several hours a day outside in the sunlight every day. Um, but we just don't. We get a few minutes at the most, and the sunlight you see through the windshield of your car during your drive is not sufficient. The windshield blocks out most of the radiation that's needed to convert vitamin D. So we need more exposure than that. And we're kind of an indoor species now, and we're not getting in vitamin D. And this N-acetylcysteine and quercetin and vitamin C and curcumin, these are things that we should be getting through our food ideally. And if you eat a well-balanced diet, you should be getting this melatonin. This is just good sleep hygiene, would give you probably adequate melatonin. But anyways, if you can't do that, I guess there's not much danger in taking any of these supplements, and that's fine. But um, just happened to see this thing pop up. Thought it was interesting that they finally have the results of this study, October 21st, 2022, more than 2 years after the start of the pandemic. And this just goes to show you that getting randomized clinical trials done and reported just takes a long time. And in the case of like diseases like cancer and things like that, we can maybe afford to wait this way. But in the setting of a pandemic, you kind of do have to use your best judgment and go on limited data and do what you can, I think. Um, and so people were guessing that ivermectin was helpful initially, and I don't fault them for that. There was lots of preclinical data that made that a somewhat reasonable assumption, but now I think it's fairly clear that that probably is not the case. All right. I'll link these papers below if you're interested. Thanks for watching, everyone.